Uh-oh. What's going on now? Now all the other girls want their appendix out too. Good luck, Miss Clavel. Hi, I'm Dr. Josh Jarvis, and today we're going to talk about the radiologic appearance of acute appendicitis. But before we get into any of that, we need to talk a little bit about what an appendix is in the first place. The human GI tract consists of the esophagus, stomach, small bowel, and large bowel, or colon. The first part of the colon is called the cecum, and hanging off the cecum is a thin, dangly bit of bowel that doesn't go anywhere, which is the appendix. Now, the word appendix typically refers to any extra bit of something. Just like the appendix of a book is some supplemental information that isn't necessarily vital to the main text, the appendix is a bit of extra bowel that's there, but we don't really need. Now, there are a lot of theories about what the appendix is for. Maybe it's a place for good bacteria to hang out until they're needed, or maybe it helped our ancient ancestors digest plants, but honestly, we don't really know. Mostly it's just a ticking time bomb waiting to cause us problems. Which brings us to appendicitis. When you tack itis on a word in medical terminology, it means inflammation. So appendicitis means inflammation of the appendix. Since the appendix is this stupid little loop of bowel that doesn't go anywhere, sometimes stuff can go in and can't get out. Bits of poop can form little calcified clumps or stones that get stuck in the appendix called appendiculitis. Now, as the appendix gets blocked up, bacteria can get out of control and fluid accumulates, which increases the pressure and decreases blood flow. And without blood flow, the appendix will start to die. And since dead tissue quickly begins to fall apart, it increases the risk for rupture. Rupture can lead to even worse infections, which can be super dangerous and even potentially deadly. So how do you know when you've got acute appendicitis? Well, you'll have abdominal pain, which classically starts out more diffusely, then localizes to the right lower quadrant of the abdomen where the appendix is located. You might also have fever, as well as nausea and vomiting. Now, these symptoms aren't terribly specific and can be seen with a lot of different problems. And since the treatment for acute appendicitis often involves surgery, it's important to make sure it isn't just gas or Chipotle or something. This is where radiology comes in. So what is the radiologic appearance of acute appendicitis? Well, as I mentioned in my X-ray and CT videos, abdominal X-rays aren't terribly helpful because of their relatively poor soft tissue contrast. So CT is generally the go-to imaging for appendicitis. Here's a CT of a normal appendix. You can see that the appendix is thin and air-filled, and the surrounding fat is relatively clean. With acute appendicitis, the appendix becomes dilated, with 6 millimeters in diameter, a typical cutoff for a normal appendix. The appendix also tends to become more fluid-filled, and the wall may become thickened and denser on contrast-enhanced CT due to increased blood flow. Lastly, and probably most importantly, you'll begin to see inflammatory fat stranding surrounding the appendix. Now, you'll hear radiologists talk about fat stranding a lot with regard to CT, and what this means is the fat surrounding a structure such as the appendix begins to look hazy and indistinct with increased density. This is because infection or inflammation increases blood flow and lets fluid leak into the surrounding soft tissues and fat. Since fluid is denser than fat on CT, you end up with dense strands of fluid and tiny vessels within the surrounding fat. Here are some examples of acute appendicitis on CT. You can see the appendix is enlarged and fluid-filled with extensive surrounding fat stranding. Here's another example. In this one, you can see a calcified appendiculith at its base causing obstruction. And here's one more. Again, the appendix is dilated and fluid-filled with extensive associated fat stranding. While any of these features may suggest acute appendicitis, you need to be careful when only presented with one of them in the absence of the others. For instance, sometimes the appendix may appear dilated and measure greater than 6 millimeters, but be air-filled and without any associated fat stranding. Some people just have larger appendices than others, and it doesn't mean they have appendicitis. Also, you can have inflammatory fat stranding surrounding the appendix for other reasons, such as inflammation of the cecum or the terminal ileum, which is the last part of the small bowel. If the appendix otherwise looks normal and isn't dilated, you should look for possible other sources of inflammation nearby. But what about appendicitis with rupture or perforation? Well, in this case, there are a few things to look for. Mainly, you'll want to look for sizable fluid or air collections outside of the appendix, suggesting developing abscess. Occasionally, you may even see areas of discontinuity in the appendiceal wall, representing the site of perforation. If things get really bad, however, all bets are off. You might just see a mess of fluid and stranding in the right lower quadrant, with the appendix difficult or impossible to find since it's basically falling apart. An appendiculith in the middle of a large area of fluid and inflammation can be an excellent clue. Basically, a mess in the right lower quadrant in the absence of any normal appearing appendix should raise concern for ruptured appendicitis. Here's the case. You can see a large collection of fluid with extensive fat stranding with no normal appendix identified. Here's the appendiculate that likely started this whole disaster. While CT is excellent for assessing for appendicitis, it's not ideal for certain patients such as children or pregnant women given the radiation exposure. In these cases, ultrasound can sometimes be helpful. As I'll discuss in an upcoming video, ultrasound uses high-frequency sound waves to make images with no radiation exposure. The only issue is finding the appendix in the first place, which can be difficult given its relatively small size and the fact that bowel gas essentially kills ultrasound signal. If you do happen to find the appendix on ultrasound, the findings of acute appendicitis are very similar to that of CT. The appendix will be dilated and fluid-filled with likely increased blood flow and occasionally associated fluid adjacent to the appendix. In addition, since the ultrasound tech is scanning the patient with the probe in real time, they can assess for areas of focal tenderness as well as push on the appendix to see if it compresses or not. Here's an ultrasound of a young child with acute appendicitis. The appendix is dilated and fluid-filled and is also focally painful and non-compressible per technologist notes. Lastly, I'll quickly mention MRI as another good option for younger patients since it uses magnets instead of radiation. MRI is best suited for young adults because it has poorer spatial resolution than CT, making the appendix harder to find in smaller patients. Acute appendicitis on MRI follows the same basic theme as CT and ultrasound. The appendix will be dilated and fluid-filled. The main difference is how the surrounding inflammation appears on MRI. Without getting into too much detail on all the various MRI sequences, etc., which can be a very complicated topic in itself, inflammation on MRI will be bright on sequences where fluid is bright, such as T2, as seen in this MRI image of a patient with acute appendicitis. So that's acute appendicitis. Thanks for watching, and you can look forward to more of these imaging diagnosis videos in addition to my other radiology videos in the weeks and months ahead. Also, make sure you like, comment, and subscribe, and join the literally tens of devoted fans of radiology-based educational entertainment. I'll see you next time. All right, now where the hell are you, Goldbug?